Since the early 1970s, lasers have been classified into 4 classes and a few subclasses by wavelengths and maximum output power. 2 of these are commonly used as medical lasers, into Class 3B low-level lasers and Class 4 surgical lasers. Class 3B lasers used by MiraMate Joint Aid are non-surgical, painless, non-burning, and non-cutting forms of lasers. They have the ability to penetrate and assist in the healing of deep tissue and joints. In addition, Class 3B lasers, which belong to low-level lasers, are very safe because they do not have the intensity to damage cells. Class 4 surgical lasers are different from Class 3B lasers. They are used to cut, coagulate, and vaporize tissue. Unfortunately, there is a slew of false information in the public domain regarding the effectiveness and cellular mechanisms of Class 4 lasers. Many Class 4 laser manufacturers are intentionally misleading healthcare practitioners into believing that higher power and longer near-infrared wavelengths equate to deeper tissue penetration and better clinical efficacy. All of these claims turn out to be fancy sales gimmicks, as there are no clinical or scientific journals to support their claims. The clinical and scientific facts show that most Class 4 lasers have a low depth of penetration and a high risk of thermal damage. NIR lasers with wavelengths greater than 950 nm, which are used by most Class 4 laser devices, will be absorbed by water easily. 99% of the energy produced at this wavelength or above is absorbed before penetrating the dermis of the skin. Even the Class 4 lasers typically have higher incident power and larger treatment area. The depth of penetration is superficial and is restricted to the top layer of the dermis. So, there is no biochemical effect of Class 4 lasers due to the lack of cellular mechanism activation. The thermal effects of Class 4 lasers are the only mechanism of action remaining. Once the thermal effects of tissue have been exceeded, tissue damage is imminent. Certain manufacturers take advantage of the limited knowledge of their customers to claim that Class 4 lasers have greater efficacy than Class 3B lasers. This is unsubstantiated rubbish. The classifications categorize lasers according to their ability to produce damage in exposed people rather than the efficiency in treatment. Regarding Class 4 high-power lasers, they have not been proven in the scientific and clinical literature that high power is better than low power. In fact, the opposite has been proven to be true. Too much power and the wrong wavelength simply equates to the expense of more money without the requisite return in better clinical effects. So, MiraMate Joint Aid chose Class 3B lasers instead of Class 4 lasers. In conclusion, Class 3B lasers are best suited for therapeutic applications. Class 4 lasers have been on the market for years, but approved strictly for surgical applications. They are best suited for tissue destruction.